Welcome back to CO 5701. This week we're looking at cognitive therapies. Cognitive therapy, or CT as it's called, is a type of therapy developed by American psychiatrist Aaron T. Beck. It's now been grouped with cognitive behavioral therapies, but Beck developed this in the 1960s. And the cognitive model states that thoughts, feelings, and behavior are all connected, and that individuals can move toward overcoming difficulties and meeting their goals by identifying and changing unhelpful or inaccurate thinking, and then problematic behavior and distressing emotional responses will follow. And this would involve working closely with a therapist to develop skills for testing and modifying beliefs, identifying any kind of distorted thinking, and learning to put those new ideas into practice by relating to others in different ways and trying out different behaviors. This is a helpful model of counseling that probably every therapist uses a little bit of, and it is congruent in many ways with biblical counseling, where we really want to fill people's minds with God's Word and change their thinking because we understand who we are in Christ and what God asks of us and that kind of thing. So probably I think this model is the closest aligned or the most helpful for biblical counseling. Although, of course, it's a secular model, so the goals are different than what we might do in biblical counseling. But Beck worked with depressed people early in his career, and he found this model to be particularly helpful. He also developed the Beck Depression Inventory, and it's the second version of it. And these are used by many therapists to determine how depressed someone is. In fact, First Baptist Atlanta's Counseling Center uses this assessment. Beck's daughter, Judith, is also a practicing psychologist, still working today. Becoming disillusioned with long-term psychodynamic approaches, which were based on gaining insight into unconscious emotions and drives, Beck came to the conclusion that the way in which his clients perceived and interpreted and attributed meaning to their daily lives, which is a process known as cognition, was really the key to helping them. He outlined his approach in this book called Depression, Causes and Treatment, which was published in 1967. He later expanded his focus not only with depressed people, but to help people with anxiety disorders and many other kinds of problems. He introduced this term schema, how the underlying set of beliefs sometimes need to be altered. And because we develop these, who we are, how the world works, how people are, etc. And at the time Beck was developing this theory, behaviorism was all the rage. So this new model was controversial when it first came out. In fact, there was something of a cognitive revolution in the 1970s. Behavioral modification techniques eventually sort of joined together, giving rise to today what's prevalent, which is called cognitive behavioral therapy, or CBT. And as I said, that's a model that's probably most therapists use a bit of, however they're conducting therapy. Well, the cognitive model was originally constructed following studies by Beck to explain what is really going on when people become depressed. And it divides the mind into three sort of levels. We all have automatic thoughts, those that just sort of pop out, whatever the person, experience, or situation is. Below those, we have these intermediate beliefs, and then we have core beliefs, or basic a basic belief about life. And as a result of these beliefs, we're going to have positive or negative emotions, and positive or negative reactions to whatever's occurring. So how's it about an example? Perhaps a person had parents who were critical or rejecting in some way. In life, we're going to always have to deal with some rejection, but then that current rejection would reinforce these early learning experiences, so the person just believes they're unlovable. So in this example, that would be a core belief or schema. Then other beliefs flow from the central premise, such as, if I'm perfect, then someone will love me, which can lead to perfectionism or people-pleasing or some other kind of problem behavior. Such a person might develop automatic thoughts, such as, well, I'll never be good enough for him, or this job, or that. And they repeat these things to themselves. We always have this self-talk going on. And of course, this can lead to depression if you're always telling yourself horrible things. But if you can help someone see that their core belief is inaccurate and based on faulty information, or even what we learned as a child, it doesn't mean it's accurate. So these other intermediate beliefs should change and modify, and depression should ease. But as you can imagine, it's not going to happen overnight, but it does happen. Well, this slide is just kind of an expansion on that last one. So our early learning experiences kind of form how we see the world, how our personality is shaped, at least in the beginning. Life events can reinforce those early core beliefs about the world, because if we're looking through a certain lens, we tend to interpret everything that happens based on the only understanding we have. So these core beliefs become more cemented, and our intermediate beliefs and our automatic thoughts stem from those. So again, understanding, changing these deeply held beliefs in this model is the core to change. And think about it from a biblical perspective. If we think we're unlovable, and then we become a Christian, and we start understanding God really does love us, so people might have rejected us in the past, but God our Father accepts us and loves us, isn't that going to make a huge change in how we understand life or even interacting with other people? And of course, that's what we want to happen in biblical counseling. Well, there's lots of research showing how effective this model is, used with many different kinds of problems, even like academic achievement, addictions, depression and anxiety, we've already mentioned, bipolar disorders, people with low self-esteem, people with phobias. It's even been used in schizophrenic patients, people with suicidal ideation, people seeking to lose weight. It's a very well-researched model. So what are some of these cognitive distortions that get us in trouble? And these, if you remember from the psychodynamic defense mechanisms, and we're going to look at these similar ones in REBT in a moment, so I'm just going to mention these here. But people tend to believe it's all or nothing, sort of black and white thinking. They can overgeneralize, have a skewed mental filter. They discount the positive things that happen in life and focus on the negative. We jump to conclusions. We magnify or minimize events because, when we have a certain way of looking at life, we tend to examine things in a certain way that confirms our beliefs. We're not naturally running around trying to disconfirm our beliefs, because that's unsettling. That's something to remember about counseling. Change is tough. Okay, we do emotional reasoning where we believe our emotions are true, and our feelings aren't necessarily accurate. That's a huge concept for some people to understand in the process of counseling. We have all these should statements. I should be a perfect mother. I should make 6 figures. I should be a millionaire before I'm 30. Or other people should do this or that and the other. And we get ourselves into a state of misery with all these demands. And we personalize blame too. if we think something went wrong and somebody has to be blamed for it, we get into trouble because we're going to blame ourselves or blame someone else. Most situations are probably caused by multiple factors, and blaming never helps. So just a brief introduction to these. REBT is going to talk about, when we get to that model, we'll talk about some similar cognitive distortions a little bit more deeply. Well, REBT was developed by Albert Ellis, who was busy developing his model just about the same time that Aaron Beck was developing CT. So REBT is an action-oriented therapy method that teaches individuals to identify challenge and replace their self-defeating thoughts and beliefs with healthier ones that promote emotional well-being and lead you to the goals you want to achieve. It's similar but not identical to CT. His best-selling book was A Guide to Rational Living. He has been considered one of the most influential psychotherapists in history. Prior to his death, Psychology Today described him as the greatest living psychologist. The basic premise of this model is that it's not the events taking place in our lives that upset us, it's the beliefs we hold that cause us to become depressed, anxious, enraged, etc. The idea that our beliefs upset us was first articulated by Epictetus around 2,000 years ago. He said men are disturbed not by events, but by the views which they take of them. So according to Albert Ellis, the vast majority of us want to be happy. I think we would agree with that. We want to be happy when we're alone or when we're with other people. We want to get along with other people. We want to have one or two close friends. We want to be well-informed and educated. We want a good job. We want to earn good money. We want to enjoy our leisure time. But of course, things don't always work out the way we want. So then our goal of being happy is thwarted by the slings and arrows of outrageous fortune. When our goals are blocked, we can respond in healthy and helpful ways, or we can react in ways that trip us up. So Ellis believed that our reaction to having our goals blocked, or even the possibility of having them blocked, is determined by our beliefs, similar to CT. So to illustrate this, Dr. Ellis developed a simple ABC format to teach people how their beliefs cause their emotional and behavioral responses. All right, so A, something happens. That's called the activating event. That's the A. We have a belief about the situation, which is B, belief. And then we have an emotional reaction to the belief. That's C, the consequence. Let's take an example. Your employer falsely accuses you of taking money from her purse and threatens to fire you. That's the A. You believe B, she has no right to accuse me. She's a witch. And C, as a result, you become angry. So let's look at the same situation, but if you had a different belief. Okay, A, same thing. Your employer falsely accuses you of taking money from her purse and threatens to fire you. B, you believe, I can't lose my job. That would be unbearable. So as a result, C, you feel worried and anxious. So same event, different outcome, different emotional outcome. And we see this happen in real life all the time. Two people react completely different to the same event. And the difference is this belief that you have about it. And the labeling in this model, the ABC, makes it simple to learn and simple to explain. Well, although we all express ourselves differently, according to Ellis, the beliefs that upset us are all kind of variations of three common irrational beliefs. Each of these three common irrational beliefs contains some kind of demand, either about ourselves, other people, or the world in general. And he calls these the three basic musts of his theory. So we believe I must do well and win the approval of others for my performances, or else I'm no good. Other people must treat me considerately, fairly, and kindly, and in exactly the way I want them to treat me. If they don't, they're no good, and they deserve to be condemned and punished. And number 3, I must get what I want, when I want it, and I must not get what I don't want. It's terrible if I don't get what I want, and I can't stand it. So the first belief is going to lead to worry, depression, shame, and guilt. The second belief leads to rage, passive-aggressive behavior, and acts of violence. And the third belief might lead us to self-pity and procrastination. It's the demanding natures of these beliefs that cause problems. So less demanding and more flexible beliefs will lead to healthier emotions and more healthy behaviors. There are a bunch of underlying beliefs we have that lead to unhealthy living. I think you'll agree most people believe one or more of the following. Everybody believes I need love and approval from those significant to me, and I must avoid their disapproval or disapproval from any source. Or to be worthwhile as a person, I have to achieve and succeed at whatever I do and make no mistakes. Or C, people should always do the right thing. When they behave obnoxiously, unfairly, or selfishly, they should be blamed and punished. We also believe things have to be the way I want them to be, otherwise life becomes intolerable. Or people also believe their unhappiness is caused by things outside their control, so there's little they can do to feel any better. People believe I must worry about things that could be dangerous, unpleasant, or frightening, otherwise they might happen. People tend to believe I can be happier by avoiding life's difficulties, unpleasantness, and responsibilities. Well, it would be nice if we could do that. People believe that everyone needs to depend on someone stronger than themselves to get by. People believe events from the past are the cause of my problems, and they continue to influence my feelings and behaviors now. This model says that's not true either. You can let go of those things. People tend to believe they should become upset when other people have problems and feel unhappy when other people are sad by taking on their burdens. We don't have to do that. People also believe they shouldn't have to feel discomfort and pain, and we think in our head, I can't stand them and have to avoid them at all costs. Unfortunately, that's part of life. And people also believe every problem should have an ideal solution, and it's intolerable when one can't be found. And a better belief is that there might be some response, and there isn't always a perfect solution, and sometimes there is no solution to a problem. Anyways, those are some other common beliefs that people embrace that lead to problems. Well, the goal of REBT is to help people change these irrational beliefs into more rational ones. Changing beliefs is a real work of therapy, and it's achieved by disputing these irrational beliefs. So we've got step D. We might ask somebody, why must you win everybody's approval? Where is it written that other people must treat you fairly? Or just because you want something, why must you have it? So disputing is the D after the ABC model. When the client tries to answer the therapist's questions, they should see that there's no reason why they absolutely must have everybody's approval, they must have fair treatment, or they must receive the things that they want. That's sort of childish thinking. I mean, as an adult, we kind of learn because we get run over by life sometimes. Things don't always go our way. So when we dispute these irrational thoughts and replace them with more rational ones, the next time something happens, we should notice new effects, better behavioral choices, and as a result, better feelings. So some people incorporate the EF in this model, but if you remember the ABC and especially the D, where the work of therapy happens, that's probably sufficient. So Ellis contended, although we all think irrationally from time to time, we can work at eliminating this tendency. It's unlikely we'll ever entirely eliminate our tendency to think irrationally, but we can reduce the frequency the duration and intensity of our irrational beliefs by developing 3 insights. If we remember, we don't merely get upset, but we mainly upset ourselves by holding these inflexible beliefs. And no matter when and how we start upsetting ourselves, we continue to feel upset when we cling to these irrational beliefs. So the only way to get better is to work hard at changing these beliefs about life. It takes practice, practice, practice. Ellis also stated that we construct our depression, therefore we can deconstruct it. That's a pretty deep statement to reflect on there. But unfortunately, although some people can gain insight into why they're having these difficulties, they won't attempt to change. Again, it's hard work. It takes courage to do some self-examination, and very hard to embrace new beliefs. So think about the people that you might be counseling. It takes courage and it takes effort, and not everyone is going to give the same amount to this process. So emotionally healthy beings have to develop an acceptance of reality, even when reality is not fair. It can be highly unfortunate and unpleasant. So REBT therapists strive to help their clients develop 3 kinds of acceptance: to accept themselves unconditionally, to accept other people unconditionally, and to accept life, no matter what it brings. So each of these kinds of acceptance is based on 3 core beliefs. So to accept ourselves, we have to recognize that we are a fallible human being. We have our good points and we have our bad points. And there's no reason why we should expect ourselves to be perfect. And despite both our good points and bad points, we're also no more worthy or no less worthy than any other human being. As far as accepting other people, we have to be able to embrace the fact that other people are going to treat us unfairly from time to time, and there's no reason why we would expect everyone to treat us fairly all the time. And other people are no more worthy or no less worthy than anyone else. We all have our failings. And then when we think about accepting life, we have to recognize that it doesn't always work out the way we'd like it to. There's no reason or rule book saying it's going to work out the way I want it to. It's not fair. And life is not necessarily pleasant, but it's never, or rarely, completely awful, and it's nearly always bearable, even though it's not necessarily the way we always want it to be. So this model is been very successful, and there's a lot of experimental evidence showing its effectiveness at reducing emotional pain. It also meshes with today's demand from insurance for short-term therapy. So REBT therapists tend to be a bit directive. They do develop a relationship with their client, or otherwise no one's going to listen to them, of course. But it is a generally directive model, but it's very easy to understand, to teach new therapists and to teach the client, because the client has to understand this too. Well, let's look at this model. How compatible might it be to biblical counseling? Tan notes that it's a realistic, directive approach, and the Bible focuses on renewing our minds. There's a lot of research showing its effectiveness. It could be used with distinctly Christian beliefs to counter irrational thinking. However, of course, there's no mention of faith, sin, God, or anything related to faith. Ellis was pretty much an atheistic person. He softened maybe toward religion later in his life. I guess we could say agnostic. So if we use it, we have to make certain that the changed beliefs are in alignment and agreement with Scripture. A lot of Christian counselors use some form of cognitive therapy even if they're not realizing what they're doing it, they're kind of falling in that field when we challenge faulty beliefs and offer biblical truths as alternatives. For instance, to the person who believes they are unlovable, of course we're going to teach them about the sacrificial love of God for us, His children, and how much He values us. I'm just going to touch briefly on the other models mentioned in your reading this week. Donald Meichenbaum is the father of stress inoculation training, or SIT, which is similar to the other cognitive models because it addresses beliefs and erroneous thinking. The first stage of SIT is called conceptualization, and this is where a counselor would help the individual identify their stressors and how they respond to these stresses, and how successful their responses have been. Patterns of self-defeating internal dialogue would be identified here. And the second stage is called skill acquisition and rehearsal. So that's where the counselor would help the person develop and practice positive coping statements to be used in stressful situations. Other techniques like relaxation and making a realistic appraisal of the situation would also be practiced. In this third stage, called application and follow-through, the individual would begin to apply these newly acquired skills to progressively more difficult situations in the real world, kind of building up their skills through some practice. The therapist would provide support and further training as necessary. And lastly, your book mentions Arnold Lazarus, who developed multimodal therapy. Its great strength, for me at least, is in the easily identifiable way it reminds us to assess counselees in order to assess what's going on with their problem in a holistic manner. So BASIC ID is the acronym he developed. It stands for the following. B represents behavior. So we do want to examine how people are behaving. We can see it in the actions they take, their habits, their gestures, and their lack of, appropriate affective behavior. A stands for affect, that's a term meaning emotion, which can be seen as a level of negative feelings or emotions that are being presented to us. S is sensation, or negative bodily sensations or physiological symptoms such as pain, tension, sweat, nausea, racing heartbeat, etc. that people might be experiencing in the midst of their pain. I stands for imagery, which is the existence of negative cognitive images or mental pictures they might be having. C represents cognition, or the degree of negative thoughts, attitudes, or beliefs someone holds. The second I stands for interpersonal relationships and refers to the ability, how well do they have successful relationships with others? What are their social skills like? Who are their support people? And D is for drugs and biological functions. So how's their health? What medications might they be on? And other lifestyle choices like, maybe like drinking or smoking, or things that might be contributing to the problem. So it's a very good way of assessing people in a holistic manner, because we do need to get the big picture to figure out what's going on with people. I hope this lecture helped to clarify the cognitive therapies you're reading about a bit more for you. You may see some value in the techniques in these models, especially when it comes to addressing irrational thinking. If you're interested in this model, please read further on them. There are many, many books on these topics, and as I said, many forms of cognitive therapy are widely used today. I'm going to post a link to a Christian CBT workbook developed by Duke University under a grant program. It's free to use, and you'll see the kinds of homework or exercises that you might assign to someone to help them change these unhealthy thinking or dysfunctional thinking patterns. This workbook developed by Duke has theological reflections on these distorted thinking and scripture that applies. So this might be one way of really discipling and offering biblical counseling to hurting people. Well, thank you so much for your attention and hard work in this course, and I look forward to your thoughts and responses to our readings on cognitive therapy this week. Thank you and have a blessed week.